Hi everyone. In this video, we'll learn about the signs and symptoms of NBCCS, the importance of regular screenings, and how to manage your risk. Nevoid basal cell carcinoma, or Gorlin-Gold syndrome, is an autosomal dominant disorder related to mutations of the human homologue of the Drosophila PTCH gene. The expressivity of the phenotypes is variable, although they may include multiple basal cell carcinomas of the skin, palmar and plantar pitting, skeletal abnormalities such as bifid ribs, vertebral fusion, polydactyly, shortening of the metacarpals, temporal and temporoparietal bossing, minor hypertelorism, mild prognathism, calcification of the falx cerebri and other parts of the dura, medulloblastoma, and multiple OKCs. Nevoid basal cell carcinoma syndrome may be detected early in life, usually in the second or third decade, with the development of OKCs within the jaws and skin basal cell carcinomas. Although genetic testing of relatives is a useful diagnostic tool, approximately 20% of new diagnoses represent spontaneous mutations of the PTCH gene. Typically, multiple OKCs develop in multiple quadrants earlier in life. A thorough radiologic examination including MDCT or CBCT imaging is required to detect all the jaw lesions, and regular follow-up of patients diagnosed with the syndrome is important to identify new and recurrent OKCs early, particularly because the recurrence rate of OKCs associated with the syndrome is higher than of solitary OKCs. This image shows a panoramic radiograph. Picture A shows a case of nevoid basal cell carcinoma syndrome. Note the odontogenic keratocyst related to the developing mandibular left third molar and a large OKC within the left maxilla that has displaced the left maxillary third molar. Axial multi-detector computed tomography MDCT image of the same case in picture B, showing the OKC associated with the mandibular left third molar, also seen in the panoramic image, and another very small OKC in the right posterior mandible, which is not visible in the panoramic image. Another axial MDCT image in picture C from the same case reveals the large OKC in the left maxilla and two other OKCs not readily apparent in the panoramic image. The imaging features of OKCs that arise in nevoid basal cell carcinoma syndrome are identical to those associated with solitary OKCs. The presence of a corticated periphery and the hydraulic cystic features of the lesions differentiates nevoid basal cell carcinoma syndrome from other abnormalities characterized by multiple radiolucencies like multiple myeloma. Cherubism presents with bilateral multilocular, radiolucent lesions with internal septations, but these usually produce significant jaw expansion, features that are not characteristic of nevoid basal cell carcinoma syndrome. In addition, the lesions of cherubism displace teeth anteriorly or mesially, which is a distinctive characteristic. Occasionally, patients with multiple dentigerous cysts may show some similarities, but dentigerous cysts are more expansile. OKCs in nevoid basal cell carcinoma syndrome are treated more aggressively than solitary OKCs because they appear to have an even greater propensity for recurrence. It is reasonable to examine the patient annually for new and recurrent cysts with panoramic and intraoral imaging. Should these images reveal areas that are suspicious for new or recurrent OKCs, MDCT or CBCT should be ordered. A referral to a medical geneticist should also be made. Thanks for watching. If you enjoyed this video, be sure to like and subscribe for more content. Goodbye.